Our top story, though, tonight at 6, Georgia doctors and nurses expressing concerns about being among the first to receive any coronavirus vaccine that is approved. In some cases, they say they will not get it.
Hospital leaders sharing their team's worries, concerns with the governor today while talking about how the vaccine will be distributed here in our state. Joe Hankey has more tonight.
During a roundtable discussion this afternoon with leaders from hospitals in Atlanta and around the rest of the state, Governor Brian Kemp said if Pfizer, during a December 10th meeting with the FDA, receives approval for its COVID-19 vaccine, it could begin arriving in Georgia only days later. But the director of the state health department in the same roundtable discussion this afternoon said she is learning doctors and nurses around the state, some of them, might not be willing to immediately take the vaccine. In his roundtable discussion this afternoon, Governor Brian Kemp said he is aware of new CDC recommendations to first offer a vaccine to the nation's 21 million healthcare personnel on the front lines and the 3 million residents and staff in long-term care facilities.
And the state intends to follow those guidelines and match those prioritizations.
But Dr. Kathleen Toomey, director of the Georgia Department of Public Health, says she is hearing some doctors and nurses may not be interested.
I'm getting feedback from Grady staff and others that they are not going to get vaccinated, or at least are going to wait a year or more.
Medical staff possibly holding off on the vaccine extends beyond the metro, says Don Avery, CEO of Fairview Park Hospital in Dublin, Georgia.
I asked every single one of my nurses, and about 50-50 whether they were taking it. There's a lot of hesitancy.
At issue, the vaccine could be made available less than a year after research began, a great development to fight back against COVID-19, but also a product of a speedy development, a lack of time for top infectious disease experts such as the ones at Grady and Emory hospitals to review the studies behind the vaccines, says Grady's CEO.
And they're just not getting their hands on the core literature related to these drugs to be able to make that judgment.
And Governor Brian Kemp says that will be a main hurdle when a vaccine finally is made available here in Georgia, making sure people are comfortable and willing to take it.
Historic new